Bismillahirrahmanirrahim. Hello friends. Today we will discuss about the hepatitis. What is hepatitis? Introductions. Hepatitis is a broad term that means inflammation of the liver. It's the most commonly caused by the viruses but also caused by the drug, alcohol, chemicals, autoimmune disease and metabolic abnormalities. Etiology of the hepatitis are viral hepatitis, alcoholic hepatitis, autoimmune hepatitis, non-alcoholic steatohepatitis. Viral hepatitis. In viral hepatitis, we have five hepatitis virus, which is A, B, C, D, E. Five types of hepatitis have been identified: hepatitis A, B, C, D. Hepatitis A is always an acute short term disease, while hepatitis B, C, D are almost likely to become ongoing and chronic. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. The hepatitis A and E virus typically cause only acute or short term infections. Other less common viruses can also cause liver diseases. These include cytomegalovirus, herpes virus, rubella virus, Epstein-Barr virus. Incidence. Viral hepatitis is a major public health concern. 10 million cases occur worldwide. It is nearly universal during childhood in developing countries. India is a hyper endemic for hepatitis, a virus infection. Annually, over 1 to 2 lakh Indians die during the due to illness related to HPV infections. Worldwide, 170 million people are infected with hepatitis C virus. A hepatitis A virus, also known as Hep A, a highly contagious liver infection caused by the hepatitis A virus. Hepatitis A virus is a ribonucleic acid virus of the enterovirus family. It can cause acute hepatitis with jaundice, also cause acute liver failure. It does not cause long-term infections. Incubation period is 3 to 5 weeks with an average of 28 days. It is transmitted primarily through the fecal oral route. Source of infection is crowded conditions, poor personal hygiene, poor sanitation, contaminated food, water, shellfish, person with subclinical infections, infected food handler. People prevalent in underdeveloped countries. People who travel to developing countries more likely to get Hep A virus. Signs and symptoms are fatigue, fever, abdominal pain, nausea, jaundice, weight loss, itching, sharp pain in right upper quadrant of the abdomen, anorexia. Diagnosis or etiology: blood test. Two kinds of antibodies to the virus: IgM antibodies and IgG antibodies. IgM antibodies show acute infections. IgG antibodies shows previous infections or immunization. Management: there is no drug therapy for the treatment of acute hepatitis A. Rest according to the patient level of the fatigue. Hospitalization: a small frequent feeding or a high calorie low fat diet. Protein are restricted. Vitamin K injected if patient PT is prolonged. IV fluid and electrolyte replacement. Antiemetic drugs. Hepatitis B or Hep B virus. Hepatitis B virus can cause acute or chronic infections. Acute hepatitis B infection may last up to 6 months with or without symptoms, and infected persons are able to pass these viruses during these times. Chronic hepatitis B is defined as a persistence of HBs antigen for the 6 months and or more for acute infections with HBV. Continue. Incubation period is 2 to 5 months. Hepatitis B virus is a complex structures with three distinct antigens. We have hepatitis core antigens. Hepatitis B core antigens are present, surface antigens, and we have independent protein circulating in the body, which is hepatitis E antigen. Mode of transmission is mainly sexual contact, recognized as ST, sexually transmitted disease. It is much more infectious than the HIV. Further mode of transmissions are parental or pre-mucosal exposure to blood or blood products, perinatal transmission. Source of infections are continuated needles, syringes, blood products, homosexual men, tattoo, blooding, piercing with contaminated needles. Occurrences are for all age but mostly affect young adults worldwide. It is the main cause of cirrhosis and hepatocellular carcinoma worldwide. Signs and symptoms of the hepatitis B virus are abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea, vomiting, fatigue, and jaundice. Diagnosis: blood test, AST, ALT, ALP, GGT, serum protein, PT, urinary bilirubin, urinary urobilinogen, total serums bilirubin. They are the products which are come from the or make from the uh, uh, livers. Serological test: HB surface antigen, anti-HB surface antigens, HBe antigens, anti-HBe, anti-HBe, IgM, IgG, hepatitis V genotyping. Liver ultrasound transient elastography can show the amount of liver damage. Liver biopsy and fibro test. Management: treatment of the acute hepatitis B is indicated only in patients with severe hepatitis and liver failure. Rest vitamin supplements. Avoid alcohol. Treatment of chronic hepatitis B: nucleosides and nucleotide analogues such as tenofovir, adinofovir, lamivudine, interferon, standard interferon A, pegylated interferon. Liver transplant. Hepatitis B virus is an RNA virus. Incubation is 14 to 180 days, average 56 days. In most cases, is transmitted through the blood or blood products. Prior to 1992, it is also transmitted through unprotected sex and contaminated or sterile needles. It is found in IV drug using it's found in IV drug users and renal dialysis patients. It can result in both acute and chronic illness. Chronic hepatitis C virus infection result in liver cirrhosis. There is no vaccine for hepatitis C virus. Diagnosis: hepatitis C antibodies, hepatitis C genotyping. Management: in the patient with acute hepatitis C, treatment with pegylated interferon within the 12 to 24 weeks of infection reduce the development of chronic hepatitis C. Chronic hepatitis C: pegylated interferon, ribavirins, ribitol, protease inhibitors such as Incivix and boceprevir. Hepatitis D or delta hepatitis is a dependent virus for the on the hepatitis B virus infections. Hepatitis D virus is a defective single-stranded RNA virus that cannot survive on its own. It requires hepatitis B to replicate. Incubation period is 2 to 26 weeks. Chronic carrier of HB always at risk of transmission. Source of infections are same as hepatitis B virus. Hepatitis D virus is only possible if a person is already infected with hepatitis B, or person can be infected with both viruses at the same time. Diagnosis: anti-HDV antigens. Treatment: for the hepatitis D virus, the treatment is interferons. Hepatitis E virus is an RNA virus and incubation period is 15 to 64 days. Hepatitis E virus has a fecal oral transmission routes. Source of infection is contaminated water, poor sanitation, found in Asia, Africa, Mexico, more common in adults and severe in pregnant women. Hepatitis E usually resolves on its own within 4 to 6 weeks. Treatment focuses on suppurative cares, rehydrations, and rest. Diagnosis and etiology: anti-hepatitis E virus IgM and IgE virus RNA quantification. Treatment: there is no specific treatment capable for altering the course of acute hepatitis E, as the disease is usually self-limiting. Hospitalization is usually not required. Hospitalization is required for the people with the fulminant hepatitis. Pathophysiology: during an acute hepatitis, liver damage is mediated by the cytotoxic cytokines and natural killer cells. Cytokines and uh, CK and cytotoxic cytokines cause lysis of infected hepatocytes. It leads to the cholestasis. Liver cells can regenerate after acute infections. A chronic viral infection causes chronic inflammation and causes fibrosis over decades. Fibrosis can lead to the cirrhosis. Clinical manifestations. Clinical manifestations of viral hepatitis are classified in an acute or chronic phases. Manifestation of acute hepatitis are as follows. Symptoms are similar to mild flu. Acute hepatitis symptoms are anorexia, nausea, vomiting, constipation, or diarrhea. Right upper quadrant discomfort because the levers are placed over there. Malaise, fever, headache, arthalgia, urticaria, hepatomegaly, splenomegaly, weight loss, jaundice, dark urine, light stool, decreased sense of smell and taste, bilirubinemia. Chronic hepatitis symptoms are malaise, easily fatigability, hepatomegaly, myalgia, elevated liver enzymes. Complications are dehydration, hypokalemia, chronic carrier hepatitis, cholestatic hepatitis, fulminant hepatitis, liver cirrhosis, hepatocellular carcinoma with the hepatitis B virus or C virus. Thank you very much. Please subscribe the Dental Knowledge page and press the bell icon for daily updates.